It all started one morning when Jeff Koehn was shaving.
I noticed a bump on my neck.
He made an appointment right away with his Sanford Health primary care provider in Watertown, South Dakota.
He saw me right away and he was concerned about it. Could be leukemia, it could be a few different things, but it was certainly something that was suspicious.
Koehn called down to the ear, nose, and throat clinic at Sanford Health in Sioux Falls, South Dakota.
And they said, well, we'll come in November 1st. And I feel like they called me before they got the results, because they called me like 2 hours later and they're like, we want to see you tomorrow.
He traveled to Sioux Falls and was told he had throat cancer that had spread to a lymph node.
3 weeks later, I'm in. He does a surgery. I'm in the hospital for about 4 days, something like that.
After the surgery, Koehn was told about Evolve, a clinical trial that would cut his radiation time drastically.
Your normal treatment of radiation is like once a day, 5 days a week for 6 weeks, 30 shots. Well, this one is a lower dose of radiation. It's 20 doses of radiation, but you do 2 a day. So it's really intensive, and you do it over 10 days.
Dr. Stephen Powell is a medical oncologist at Sanford Health in Sioux Falls. He said Koehn's cancer is common and was actually very treatable.
Unfortunately, we treat those patients exactly the same as we treat somebody that has a very aggressive or bad cancer, so they get the full intensity of therapy.
Decreasing the dosage of radiation through Evolve could mean less side effects for patients.
Most, not all, but most of the long-term side effects from the treatment are from higher doses of radiation.
Koehn went through the Evolve trial that spanned 10 days. 3 months later, at his PET scan, he was cancer-free. His take-home message: trust your doctors and don't wait to seek care.
To me, one thing that I did is I really trusted Dr. Alapati. I just felt that, I'm like, you know how you do look him up and you're like, okay, so this is a surgical oncologist that specializes in cancers of the head and neck. I'm like, this is the dude. You know, this is the guy.
In Watertown, Simon Floss, Sanford Health News.